But just wanted to say hello to everyone who's joining us. Thank you so much. I hope everyone's staying safe and healthy during this incredibly stressful time. My name is Jen Christensen, and I'll be moderating today's webinar. For those of you who are LGJA members, welcome. We're so glad to see you. And thank you for joining us for what's, I'm sure, going to be our first of very many helpful virtual sessions that NLGJA will offer. I'll mention this again at the end of the webinar, but if you have any ideas for programs that you would like us to do, send us an email and we would love to try and make that happen. That would be fantastic. Educational opportunities are key to our mission at NLGJA. For those of you who are new to our organization, NLGJA is the Association of LGBTQ Journalists. We're presenting today's webinar through the partnership with and through the support of the CDC's Partnering and Communicating Together program created to stop HIV, also known as PACT. Speaking of that partnership, I want to remind you that the next HIV and AIDS Awareness Day is National HIV Testing Day. That's on June 27th. So please help us spread the word about the importance of HIV. Help us raise awareness about it and help your readers and audience know what they are for testing. As we wait for just a few more fellow participants to join us, let's take a few moments to share just a couple of the housekeeping matters. This session is expected to run about an hour or so, but we can kind of keep going if there are lots of good questions. At the end of our more formal discussion, we really want to make sure that we have time to address your questions. All of your microphones are going to be muted throughout the session, so don't worry, nothing embarrassing will happen. But please share your questions through the Q&A tab, and we'll do our best to answer them. This presentation is also being recorded and will be available soon at nlgja.org new ways. Yay. Now with that out of the way, and now that more of you have joined us, let's talk a little bit about today's discussion. So this novel coronavirus is really unlike any pandemic that we've seen in our lifetime. We've more than 1.5 million cases in the US. And my guess is if we keep at this usual pace, we're going to have more than 100,000 deaths by next week. Let's just think about that, next week. It's incredible. Yet we can learn from the coverage of other pandemics and epidemics. And when I speak with infectious disease specialists, they often mention that their work first started when they were trying to understand HIV. Since the HIV epidemic started, the WHO says 75 million people have lived with HIV. Currently, they think there are about 37.9 million in the world. There are real lessons that we've learned in covering people who live with and unfortunately sometimes die with these diseases. And today we've got some of the best experts in the business who can share their expertise and help us think through how we can better cover the pandemic that's before us. We'll also talk about what parallels not to draw between the HIV and COVID-19 epidemic and pandemic. So, well, for sure. So to help us with this discussion, we really and truly have some of the best experts in the business. Let me introduce them to you. Let me first say, my name is Jen Christensen. My pronouns are she, her, and hers. I'm a medical producer who works with Dr. Sanjay Gupta and Elizabeth Cohen at CNN. I'm a print reporter in my free time, and I am a digital reporter on CNN.com. I'm based in Atlanta, and I'm also NLGJA's Vice President of Print and Online and the immediate past president of the National Board. This is truly the most I will say during this whole thing. But it seems like we have a good gathering of people. So, yay. So joining us today, we have an amazing group. We have Olivia Ford, who is the consulting editor of The Well Project. She is also an amazing writer, absolutely phenomenal. And she's won many awards, including NLGJA awards. Hey! We also have a fabulous, fabulous editor, the PA's editor-in-chief, Oriol Gutierrez, who's also a former NLGJA board member and chapter leader. And finally, we have an NLGJA, another multiple award winner of My Fabulous Disease, publisher and blogger, Mark S. King. I am so honored to be in the presence of these great, great spirits. And I think that enough of you have joined now, so I can stop vamping and let's just get started. So first, Mark has asked me, and I think this is such a neat idea, because we all write and report on these issues, but we come at it from at this topic from different backgrounds. Mark's asked me to start off by talking about how you describe yourselves in a short sentence about what it is that you do in this space. So Mark, why don't you start, since this is your idea?
Thank you, Jen, and thank you to NLJ-GJA for hosting this important conversation. I am a guy with HIV and a keyboard. That is, I write first person. I used to be called a columnist back in the day when my words would appear in things called newspapers. And now, of course, in a digital format, I'm known as a blogger. All I know is I like to make my point in about 750 words.
Olivia, how do you describe yourself?
Well, officially, as you said, I'm actually the managing editor with the Well Project, and I'm also a freelance editor and writer. So that's kind of the official line. But when given a couple of more words, I often describe myself as a community-centered writer and an editorial doula. So I'm mainly an editor. I mainly kind of process and with the words of others and work with other folks who are, for whom writing is their main is their main purpose. But I also occasionally have the honor of getting to step into that writer role as well. So, and I consider myself to be kind of based in HIV and other overlapping communities. So I probably said way too many words.
I love editorial doula. That I'm stealing that. Oriol, are you a doula as well?
I don't know that I adopt the word doula, but I definitely I definitely am an editor, and I think just primarily, I'm a journalist. That's how I would describe myself first and foremost. But besides that, yeah, I'm not really a writer. Like I can cook the words better than I can, put them down on paper. So I think that's how I would frame it.
Well, let's talk about the connections. Let's just dive right in between HIV, AIDS reporting, and how that previously has worked and how it works now, and how this novel coronavirus is covered. What do y'all think from your work in that space? What's informed what you're seeing with this pandemic? What's going on? Olivia, why don't we start with you?
Thank you. What's actually, that was a couple of different questions at once. I'm trying to sort of figure out how to.
I know, I do the thing that I tell beginning reporters now.
No, it's wonderful because there's so much to speak to that, yeah, it makes sense to sort of give a many layered question. So I think let me try to reflect it back to you. So basically, where are we at in terms of HIV reporting, or sort of how far have we come, or where have we come from, and where does kind of reporting on COVID-19 come in?
Yeah, I think let's start at the very beginning.
Okay. Well, the first cases of HIV were reported on in the U.S. in 1981. And that's something else. I mean, not to jump directly into to differences, but that's something that's come up over and over again in conversations about HIV versus coronavirus reporting. Is that we've had going on 40 years of community building and kind of practice in covering HIV, whereas we're all playing catch up as far as we're all just learning about coronavirus. We're all learning about it's the way that it's going to affect our lives is very rapidly unfolding. And though on the other hand, I do want to kind of lift up the fact that HIV reporting doesn't stop where coronavirus reporting begins. I mean, we're still on the line. We're still weaving the line of kind of a lineage of HIV reporting because the HIV epidemic continues. I know that I am privileged to be in this community. I learn something every day, being able to be involved in covering an epidemic that is so complex, so nuanced, and still evolving. And the way that we talk about it is still evolving. Even the nearly 13 years, I call myself kind of a teenager in the fields that I've been working mainly in HIV-specific media. There have been a lot of changes, but that that trajectory of learning and of evolution is definitely greatly accelerated when it comes to coronavirus, just because of the nature of the condition, it really knocking us all for a loop. And though I do think that there are some lessons too that I know that we'll all have the chance to kind of dive into, that I've seen through the reporting that has come out around coronavirus, that I imagine people are taking cues from HIV reporting, whether they realize it or not. And there's much more to say about that, but I don't know if I've addressed any of the questions that you had, but I'll kick it over to one of my co-panelists to continue.
That's a good start. It's a good start, Olivia. You set the stage. I guess since I'm talking, I guess I'll keep talking. Yeah, I mean, just to build on, I guess, what Olivia's been saying, I mean, the idea that, HIV is still here is something that I think gets lost in the conversation about HIV. I mean, it's an ongoing epidemic. And if there's anything that, top line that we can kind of learn from that is that, we are so at the beginning of COVID-19 that to think that we're anywhere near the end is, I think, premature at best. And that the reporting needs to kind of get into a marathon mode. Right now, we've been very much in playing catch up, just like the science has been playing catch up. All we've been doing, it feels like 24/7, is just finding out new information and then passing it along. That's essentially what we've been doing. And I think we're getting to a place, sadly, with 100,000 deaths, that it's a time to start being more reflective in what we're doing, thinking deeper about the ramifications. And that certainly is something that we went through with HIV. So there's a lot of parallels there.
Mark, do you see parallels as well?
I see parallels in terms of the general sense that something bad is happening and something bad is coming, and how much worse will it get, especially in these early months. The sense of kind of dread, mortal dread, what's to come. That's where I felt closest to the early years of HIV, was this sense of just a low-grade panic. What might, what are we, oh my gosh, what is this going to bring to us? And that sort of existential dread is something that I remember very clearly from the 80s. It's also true, though, and you can't compare it with, of course, without talking about what's different. And what's different is the speed with which we share information. We didn't have the information superhighway back in 1985, right? And so the speed with which something goes from rumor to, oh, I heard something about this new drug, test, vaccine, what have you. And suddenly to see it come out of the lips of a journalist or a news source, that was not an immediate flash. And of course now it is. And that brings a lot of responsibility, doesn't it? In terms of being respectful of what the information is and who is saying it, and how, what the source is and whether it's worth even repeating. The lightning speed is very, very different than it was then.
What from your all's work in this space has informed how you go about getting at the rumors, trying to to separate fact from fiction that we get from all corners?
As a person living with HIV for 35 years and writing about it about as long, somebody said, "Oh, you heard about this this new early trial, early reports of some development," and I'm like, "Oh, that's interesting." And that's as about as excited as I get when Oriol talks about this as a marathon. I'm Charlie Brown, and I'll tell you, the HIV vaccine football has been pulled out from under my feet more times than I can count. This is vaccines are not the result of press conferences or boasting or tweets, right? They are the result of science. and careful research and patience. And I say that because I think that's what we can learn about HIV research, or research into any other thing going on the planet that needs treatment and cures and vaccines, is let's not get sucked into this game that our current administration wants us to play, which is right after the election, you just wait, without receiving that information with a really critical eye. I don't even think the people that are trying to pacify Trump, even at this point, could say anything like that with a straight face, and yet some of them are.
What about you, Olivia? I'm sure you're getting pitches and people who are trying to, speak to you about truth and and maybe not truth. How do you determine the difference? What sources do you go to? How do you know?
Well, actually, I wanted to speak a little bit to something that Mark was saying, and then kind of dovetail into the question that you asked. One thing that is similar from kind of the history of HIV reporting, though we're in a very, very, very different context now with a particularly, I'll say the word dastardly administration. But even in the early days of HIV, there was a zeal to call this over. To say that even, this predates my engagement with HIV media quite a few years, but I do remember reading reports that in like the late 80s, AZT was lifted up as kind of was going to be the thing that was going to bring us out of the HIV epidemic. And really even mainstream media, there's this desire to close the book on this frightening period in our lives, in many people's lives, though again, by no means did HIV or COVID-19 affect all communities equally. And that's what we're seeing here with, though for very, the reasons are complex, but this zeal to put forward, even, remdesivir, the kind of promising treatment, will still need to go through processes, as Mark said, and we know about those processes in HIV. So it's very clear when there's a report on, a treatment or a vaccine just around the corner. That still happens in mainstream media with HIV. Whenever there's a new development, it's misinterpreted as something that, your cousin living with HIV is going to be able to get tomorrow if you're not someone who's necessarily engaged with HIV media regularly. So that said, I mean, I appreciate that a lot of the reports now about COVID-19 are lifting up the fact that we need to look to peer-reviewed journals for accurate information. We need to look to actual scientific sources, and really dig deeper into any reports that we see about treatments, any reports that we see about remedies or things like. I remember in the very, very early days of coronavirus, like maybe mid-March, I was texted something about if you gargle with hot water and swallow it, then that kills the coronavirus in your gut, and then you won't be infected. Spread the word. It's really important that our communities know about this so that we can protect ourselves and each other. And I understand the kind of the tendency to want to do that. I mean, if this is something that's so new and so terrifying, we want to be able to protect ourselves and each other, but we have to take our paces. We have to take our time and recognize that these things don't come out of nowhere. So that said, I mean, peer-reviewed journals, scientific sources. I mean, CDC. Our current relationship with CDC is complicated. I mean, even within HIV, we know that oftentimes CDC reporting on a guideline is kind of the last step in a long process of research and advocacy. But nowadays, even more so, I take the CDC information that's put out alongside. I kind of immediately have to kind of Google and search for what vetted news sources have said about that reporting, basically, because again, as the speed is accelerated and the aims of information sharing are a little bit a little bit, are quite complicated nowadays. It's really important to check several sources. And honestly, I mean, I hope this doesn't sound like a self-serving comment, but HIV community media is a really good place to start. I mean, our journalists were all, and our news sources were all ready to step up to this plate and help people understand how to read the news about COVID-19, about how to, you know, and based on our experience, pause, the body, you know, these are all really good places to look for information about COVID-19. Anyway, hope that was helpful.
What do you think, Oriol?
Thanks for the plug, Olivia. It's better coming not from my mouth. So, but to speak to I guess just to add a little bit to that, I you know, yes, I mean, pause was ready. And the reason we were ready is because we've been to this rodeo. And so we got on and we're still on. And it feels like the last 3 months have been 3 years at least of just constant attention. And quite frankly, I mean, you know, a lot of people have turned to us within HIV, but also even outside of HIV, specifically because I think we are perceived, thankfully, as a trusted source. And so to speak to the trusted sources, I mean, you know, it's funny that mainstream media has taken such a lashing over the last decade, and certainly within the last few years, as being fake news. And it's like, it turns out that it's not fake at all. It's actually real news. It's news. And these are trusted sources and you should read them. And so, you know, if you're asking me like, where should I go? Well, you know, the oldies turned out to be the goodies, without mentioning specifics. So that's all I'll say about that.
Thank you. Yeah, I mean, I find in our shop, in our newsroom, we have people sending our team studies to vet and to say, and they do this regularly, but they're coming with great frequency. And in coming with great frequency, I see a real desire for hope, a real desire for medical knowledge, not just for knowledge's sake, but because, you know, people are scared and people to help educate the audience, and they're getting so much disinformation from so many different quarters. The more we can do to help calm things down and educate people, the better we can serve our purpose as journalists. I know you all have been doing that for a long time in the HIV community. Do you have audience members, do you think, that are also in that kind of frame of mind where they're really, really urgent in their seeking of information like that?
Absolutely.
You want to go ahead, Olivia? Yes.
No, someone else can start on that one. I was just nadding.
Mark,
I would
go ahead, Oriol.
Yeah, I think I was being polite, but I guess I don't have to be. So anyway, yeah, I mean, I think people just, I guess I'm just going to repeat what I said earlier about the idea that we're a trusted source and people are coming to us because they trust us. And, you know, we've kind of just made sure to be on top of it. And, you know, I feel a heavy sense of responsibility to keep doing that.
I think it might be worth adding that something that we've learned in HIV is that people wonder why we keep hammering the basics over and over and over. This is what HIV is. This is how it is and is not transmitted. Because I have to remind myself every single day, somebody comes of age, somebody starts having sex for the first time, somebody enters adulthood, and they don't know because they haven't been paying attention up until now. Now, obviously, we have a different landscape here with COVID, and news is fast moving, but I would resist the urge to want to go too far down the road, like, oh, well, we've already told people how you can get it and how you can't. Now let's dig deeper. Let's have some more complex stories. That's all well and good. Please hammer the basics, because every day somebody is paying attention for the first time. Somebody that needs to hear that message for the first time. And we have been hammering how you do and do not get HIV for 37 years. And we still have to do it every single day. On each of those websites, with the Wellness Project, the Body, Pause, you're going to find basic transmission information. And the same goes for COVID. I understand the urge and the interest of getting more complicated and getting further down the road with the story. don't forget to return to the basics every day.
Mhm. Yeah, very true. And I mean, and as I mentioned before, my primary role is as managing editor with the Well Project, in addition to freelance editing and writing. It's a very, very different source than Pause, in that we are not publishing sort of up-to-the-minute news stories. Our primary role with our online presence is an education and information, kind of a basic information role. And as far as the work that we've done around coronavirus, it really has been kind of to become a clearinghouse of reliable, nuanced, but also very basic information as that information develops. Because it's going back to what Oriol said, it's a with the knowledge that we've gathered in HIV, there is also the responsibility to kind of hold our communities and make sure that, to the best of our ability, we are equipping folks with the information, that with not only the sort of complex stories, but also the basic information that they need to understand those stories, and to understand what's happening in their own lives and down the street for them.
Can I just jump in real fast? So to speak to Mark's point about hammering the basics, I mean, in HIV, it's shocking that even in some basic stories, we still put in, basic information. So with COVID-19, we are also, doing that. I mean, and even if it feels like, oh, that's obvious. It's like, no, it's worth the sentence or two. Yeah.
And also, I mean, it's worth noting that even in HIV, the basics have changed. The basics change kind of every few years. I mean, right now we're in with undetectable equals untransmittable. The very way that we talk about transmission has changed, from when I first started in the field. So that's something that's, I mean, again, the acceleration of of new information may not be so swift as with coronavirus, but we always need to check in with our basics, and we always need to check in with our language, and our style guides change in terms of how to talk about this or that aspect of the epidemic, and that's going to happen with coronavirus as well. So yeah, it's a really important point to keep our eye on the basics, and as writers, as journalists, and also know that they're nimble, that they're going to change.
May we talk a little bit about language, since language is so key here? And I know, like at the beginning of the novel coronavirus, our guidance was to call it the Wuhan coronavirus, right? So then that took on a terrible political connotation, but that's where it began. And so that's how it was first labeled. And that has evolved over time, thankfully. So now we don't have the stigma associated with calling it what it is. So it's either novel coronavirus or COVID-19 or what other scientific language you want to use. So that language, thankfully, has changed and it's been an important evolution. But it's embarrassing to me that if you go and look in our early stories, we use that language and we don't update that language because it's for the record and we're not supposed to update it. So with HIV, you also have to be really sensitive about the way in which you describe people who live with the disease, right? And I know that there are pitfalls that people have. So can you just talk to me a little bit about some of the language that has changed? This is two questions. And then also, what are some of the horrible things that you see in covering HIV that you don't want people to make the same mistakes in covering this new virus?
I think Mark wants to go first on that one.
I think
you have a few thoughts on that.
Very, very early in the HIV/AIDS epidemic, I mean, barely enough time had since the virus was even identified. People who were living with that virus did a really remarkable thing, and that is they all got together and decided that they didn't want to be seen as victims. They hardly even wanted to be seen as patients. They didn't want these clinical markers. So they wanted to be seen as people living with AIDS. And that was really remarkable at the time, because it wasn't the sort of patient or person-centered language that the medical profession was used to. One of the many things that we have to feel proud of coming out of AIDS activism, FDA accelerated approval of clinical trials, et cetera, would be the fact that we have a different vocabulary now amongst many disease categories than we did in 1980, say. And those are, that is a language in which you have empowerment for the patient, the person living with HIV themselves. And so we get touchy about it because we have a great deal of pride in that, in legacy, and in the fact that it keeps the humanity, the focus of the humanity of that person front and center, rather than the thing that they have, this disease they have. The disease doesn't go first. Wait, here's me first, right? It's the person first, the person living with this particular disease. Now, that was almost a political movement that had a lot to do with the way medicine changed their language. With COVID, what did this show up just yesterday or last week or last year? I mean, it's hard to, we're all beyond time and space now, right? But it's not as if the patient population, those people who have been affected personally by this virus, have had a chance to even kind of like organize and decide, wait a second, we don't like the way we're portrayed in the media or whatever. And they may be the beneficiaries of that sort of language, whether they are or not. Yeah, I think it's important to look at the, and then just one more thing. And in our reporting, be careful to remember that this is that pandemics kill poor people. Pandemics kill people without the resources to reach healthcare. Pandemics kill Black and brown people. And in order to write stories that center around those populations, sometimes we have to get out of our own comfort zone. They may not be the people you have in your Rolodex. It might take more work, and it certainly has for me writing about HIV as a white cisgender man. It's taken more work and outreach for me to find the stories of people who don't look like me. And COVID is very much exactly, has followed that playbook, of course, because our healthcare system is such that it is the poor and those without resources that are going to bear the brunt of most of this. And the demographics of COVID are bearing this out, and we have to work harder, especially if you are white and male and cisgender. You are going to have to work harder to reach for those stories and find them and tell them in a compassionate way.
Mm-hmm. Yeah, and just to add to what you said, Mark, and to make the connection between that piece around extending one's reach into communities that are highly impacted, even if it may not be one's first kind of instinct as a reporter. A place to go to kind of guide one's language in kind of practicing writing about communities that one may be new to referencing is to go to those communities' news sources. Essentially, if you want to lift up the fact that Black and brown folks in your community are dying faster and in larger numbers from COVID-19, how do you talk about that in a way that that honors and doesn't stigmatize those communities? How are those communities talking about it themselves? So it's really important, I would say, to steep oneself in news sources that are coming from the communities that are most impacted, in order to kind of broaden one's language and approach to writing about those communities, because just to ensure that you're serving who you want to serve, with the information, as opposed and balancing the fact that it's important to it's vital to tell this aspect of the story and to do it in a way that that respects the communities that you're writing about it as well.
I'm kind of liking the groove from the people first language conversation to actually talking about the people, because that's kind of the point. So I'm glad the conversation has gone that way. but to kind of just 2 seconds to go back. So people first is kind of the catchphrase for the kind of language that we're all talking about. And I will do a shameless plug. If you just type in quotes, HIV and language on pause.com, the first link will be our cheat sheet, essentially, to people first language. So again, the idea that people come first, the disease comes later, but it's much broader and deeper than that, and we can spend more time on that. But the idea being that, you know, even now though, I mean, I would say in mainstream journalism, let alone other forms of journalism, it's still not a common practice. It is kind of what we eat and sleep in HIV, but it's one thing that definitely I think COVID-19 could really benefit from if mainstream sources started to finally adapt this way of thinking about things, because it quickly humanizes the story in a way that is just so profound, just the word. So that's something I hope that everyone would look out.
Right, Jess.
Absolutely. Yeah, we use the pause guide all the time in our medical unit. It's wonderful. And it's even good, even if you're familiar with it and you think you know the language, it's just always good to just go back and double check and just make sure, because people make, well-intentioned mistakes. And it's just always a wonderful guide. NLGJA also has a good style guide if people have questions about covering the community. But it's important for us to make sure that we get the language right, because we don't want to inadvertently stigmatize or offend our audience in any way. And we want to be the trusted source of information. So we have to get it right. Olivia, yes?
Oh, no, I was just going to say, I quickly double checked because I thought that this was the case, but another shameless plug, the Well Project also has a Why Language Matters article that actually pauses the first source and the additional resources on that. And it does talk about, as I believe the Pause article does as well, some of the history of that people first language. It comes from mental health as well. And also, I mean, there's this opportunity as journalists to guide the conversation and guide the way that this condition is talked about, right? I mean, right now, when we watch the news about COVID-19, I mean, the way that medical professionals approach it out of necessity is kind of the very definition of how one deals with infection. Screens over I mean, it's necessary. I mean, that's the nature of this condition, how it spreads. But it's very easy to for our language to forget that the people who are now living with this condition are not objects, are not their infection alone, are only occasionally patients or have just become patients. Patient being a sort of an identity that we all kind of enter and leave at different points in our lives. Again, to go back to the Denver principles that Mark lifted up earlier. But yeah, it's really, really an important role that we have. And I would love to see more coverage of this condition. Adopt that approach to language.
And one more thing, I'm sorry. One more thing. We're talking about lifting up, so let's lift up something else. We all have prepared notes here, right? So anyway, there's a group that's called What Would an HIV Doula Do?
Oh, yes.
And so you guys mentioned doula before, and I was waiting for a moment to sneak this in. So the idea of doula being a person who provides guidance and support. So this group, grassroots group, is doing that around HIV. And they put together a wonderful, wonderful guide called 27 Questions. And, it's really very basic stuff, but it's, at least to us in HIV, but I would be very surprised that it would be so basic to a lot of mainstream journalists, because they're never quite asked to think that deeply about even the basics of what they do. Because, from a journalistic perspective, which I totally understand, well, we're just doing the news, dude. Like, just what's the problem? So, I get that attitude, but sometimes it is worth thinking a little deeper. So I would encourage everyone to go there. It's HIVDOULA.work, WORK, and you can find the 27 questions. I mean, things as kind of easy as, why are you doing the comparison between HIV and COVID-19? And then they have a bunch of questions underneath that, kind of challenging the person that's writing to really think about, what do you want to get out of this comparison? Who are your sources? and speaking to all the stuff that we've talked about already. Like, are you talking to people of color? Are you talking to LGBT people? Are you talking to poor people? Are you talking to sex workers? You can go on. So, you know, what do you hope your readers will understand? And again, that sounds so basic, but when you unpack that, it's like, you know, that really gets to the heart of why are you doing this comparison and how are you doing it? You know, trying to avoid stigmatizing people with HIV as well as people with, you know, living with or who've had COVID-19. So all of that. So I hope everyone looks it up.
I'll let you know that it's those documents you've referenced, Oriol, are in the chat room. People are posting links to those things in case anybody on here has
over there.
Yeah, that's what that is. It's a chat room, darling. And so, you know, I wanted to. I appreciate what Olivia was saying about the humanizing, and I wanted to just point out some quick compare and contrast between HIV and COVID. One being that our social media world today is such that we haven't allowed either care providers, who are the heroes, the first responders, right, or these great heroic figures right now, which is wonderful, nor have the people with COVID, whether they've died or recovered from it, lost their humanity or even been shamed for it. See, I keep waiting for that next chapter, and that is where people start getting shamed for, well, how in the hell could you get COVID? What's wrong with you? You know, we have shamed some of those people on the beach, but the shaming is more about their risk behavior. We don't see shaming of people who then get it, like, you got it, how dare you? I'm kind of waiting for that to see if that happens, only because pandemics tend to bring out the worst in people. And when you look back at HIV, you know, and this is where I want people to be careful. Like when Oriol asked one of those questions is, why are you making this comparison at all? Mm-hmm. And I say that because you want to have great respect for both. And you want to have great respect for what we had to endure with HIV and how, and the profound ways in which it's different. And you don't want to minimize that difference. I always say that HIV is just the nasty little butt fucking cousin of COVID. And by that, I mean, in order to talk about HIV, you had to talk about bodily fluids and anal sex and drugs and condoms and sperm and vaginal secretions and all this stuff. Can you imagine this administration having that conversation at all? I'm saying we had to march through mountains of stigma and blocks and language just to get out the basic facts about HIV. Now, I am not saying back in my day, boy, was it bad. I'm just saying, let's have respect for what happened and what we had to go through. And actually, show some gratitude for the fact that today, in order to talk about how COVID is transmitted, thank God we don't have to talk about any of that. We can just, it's pretty simple to explain that to people. And I hope that the people who get COVID or survive it or die from it are not stigmatized in that way, that we keep the focus on their humanity too. Thanks for letting me have my soapbox. I'm sorry for my dirty words.
Never apologize. That was great. No, I just want to quickly, just piggybacking off of what you said, Mark, this just priceless comment came in the chat box from Rebecca Dennison, who is, in addition to a wonderful friend of mine, also just a real, just veteran in the HIV community, a founder of World out in Oakland, and she's here today and said very plain, just really perfectly summed it up to say, it's coming, but I doubt we'll see anyone saying, you got sick because God hates people who take cruises like we have with HIV. So thank you very much, Becky, for providing that really, really stark comparison to what we're dealing with now versus the stigma around HIV. And, that said, I think that what I've seen in some of the coverage of coronavirus is the fact that that some reporters are coming around to the fact that it's not behavior change alone that's going to get us out of this pandemic, because that's still even a struggle in mainstream media. Why aren't people just wearing condoms? If everyone just wore a condom all the time, then we wouldn't, then HIV would no longer would just be obliterated from the face of the earth. We know that there was a quote, I won't try to, I'll get the spirit of it without butchering it, kind of word for word. But there's a quote about kind of good behavior, is not going to get us out of a global pandemic. Just like bad behavior isn't the only thing bad behavior isn't what gets us into a pandemic, right? So yes, we need to stay at home and not shame people who, for whatever reason, need to go out or have to for their mental health.
Mhm.
I saw a really interesting article recently that's really starting to talk about the fact that, really making the connection between stay the F at home and abstinence only education. Like, how do we, it was, I think Julia Marcus in the Atlantic talking about how do we guide people in having a life amidst this pandemic, when we know that abstinence only and shaming people if they don't do the kind of abstinent thing isn't going to be what gets us out of this by itself. So, and shaming never gets us out of health crises. But yeah, and thank you again, Becky.
We have a couple of questions, if I may, from our audience. The first question is, what coverage is missing regarding COVID-19 and HIV?
A story I would like to see, and I'll receive that question like this: what story would I like to see that maybe I hadn't? And the story I would like to see is the compounding nature of trauma. Your average person living with HIV, let's say in the United States, let's say he's a gay guy. Let's say he was traumatized as a youth for being gay, and then when he tested positive, that just compounded his trauma and feelings of unworthiness and all of that. And then something else comes along that makes him feel the same way, maybe an election. Maybe federal policies, and then COVID comes along and re-trigger. It can be triggering. I guess that's what I'm saying. The triggering nature of the pandemic and the shut-in and the existential kind of dread and fear of mortality is very triggering for a lot of us who have those sorts of backgrounds, and for those of us living with HIV. That would be a story I'd like to see that I don't think has been done enough.
Oriol?
Yeah, I know Mark doesn't want us to abandon the basics, but apart from the basics, I would say that like I started this conversation, the idea of, I think we're finally entering a moment to kind of look up and look beyond. So I'd really love to see more stories about solutions to problems that have come from the crisis. You're starting to see that, but definitely that's where we need to keep going and keep building the library of articles. Is talking about solutions. The problems are in our face. Like, why we don't need to keep talking about just the problems. We need to keep now talking more about solutions to these problems, or at least impediments to the solutions, etc. Just on a really basic level, I mean, for PAUSE, and for HIV media in general, I think the idea is that we tell stories because we have found through experience that that's the stories of people. That's how we can best connect. And so I'd love to see more personal stories of people with COVID-19 or, at risk for COVID-19. They're certainly out there, and a lot of good reporting has happened, but this is about, hopefully making improvements. And I think one general improvement is continuing to humanize this throughout. So what are we talking about? We're talking about now, who are the communities most affected? Everyone's at risk, just like everyone's at risk for HIV, but we also know that there are a lot of people who should probably pay more attention to HIV than others. That's also a true thing. And so that's true too for COVID-19. It's becoming more and more so. And so listing up those stories, we need to be talking about what's happening in older care facilities. We need to be talking about what's happening in prisons and detention centers. We need to be talking about more of people of color communities, and on and on. And those are the things I'd like to know.
Olivia?
Yeah, for every, I mean, just to build off of what my comrades have said, for every vulnerability that we hear about regarding COVID-19, what are the stories of and what are the kind of mechanisms by which people who experience and live that vulnerability are, how are they getting through this? How have they coped if they're living with COVID-19, if they've acquired COVID-19? How are they how are they potentially preventing COVID-19 if they can? Again, I mean, the over and over again, the kind of wisdom that we've kind of acquired and built very, kind of through brutal conditions in the HIV community has been lifted up as instructive in this current pandemic. But what I'd really love to see also, and I've seen a little bit in mainstream media, but even more really looking at the kind of wider disability community and the wider community of people living with chronic illnesses that have really stepped up with some just excellent wisdom, excellent organizing from home. I mean, this is something that people who are living with chronic conditions have been doing for years, and have really. There are kind of patient-led small research studies. There are guides that have come forth from the very beginning of this pandemic, really trying to instruct people who may not always have to be afraid of the air when they step outside, or be afraid of what other people may be living with and transmit to them. What people who are already worrying about that, who already own N19 masks, who already have to kind of cope with the outside environment being hostile and stay in their homes potentially, what they're doing. And not only individually how they're sort of getting through this, but also what they have the wisdom that's already been cultivated in that community to share. And also, again, the storytelling piece is really, really powerful and really, really important. And I think that also this connects to something that both Mark and Oriol were saying, is that a way to sort of tell individual stories without kind of lifting up, like, this is the kind of or patient, like, this is kind of the, this is the story of a person living with coronavirus, is to tell those stories in the context of the communities that people are coming from, and the sort of systemic injustices potentially, or the overlapping health disparities that affect those communities. So people are no person is an island. We all have kind of forces of privilege, forces of oppression that shape our lives, and really talking about COVID-19 in that context is vital.
Here. I just want to add one real quick thing, and I meant to say it before. It's the most obvious thing. It's like, okay, pods and HIV media we are not only the ones responsible for talking about people living with HIV. Like, please. So mainstream media needs to be talking about HIV and COVID-19, the overlap and all those stories. It needs to be reflected outside of our bubble. So that's just kind of one obvious thing I wanted to say. And another obvious thing I wanted to say is that stories of LGBT people. I mean, there's very little data around COVID-19 and people living and LGBT people. So I just want that to be the job of mainstream media as well, to start scratching those stories and lifting them up.
I have to say, I would love to also see some of the success stories that the HIV community has had in terms of overcoming barriers to care. Because there are certainly groups out there that have reached hard to reach populations that are some of these same hard to reach populations who have underlying conditions and living circumstances that make getting access to care incredibly difficult. So to be able to hear from somebody in the HIV community to model that and say, here, look what I've done. You all have written about some of those amazing stories. I would love for them to give advice on getting to, or something that at least can show that some of these barriers are something that you can overcome if you actually put some resources into it. That's what I'd love to see. Another question, what pushback did you receive from media when you first started reporting on HIV that you're not seeing when reporting on COVID-19?
That's easy for me as a writer, and that is only because, and I promise I won't say a dirty word again, Jen, And the easy reason is because just like our government, the media wasn't paying as close attention, perhaps, as they should have to the birth of HIV in this country. And that has been much easier, obviously. So, yes, we got a lot of pushback because we were talking about populations that people didn't care so much about. We were talking about modes of transmission that people didn't really want to talk about. Now you're talking about something that could kill your grandma. It's a much more family-friendly kind of frightening story to tell than we had it. So that's all I have to say about that.
Yeah, I mean, I would say, like, you know, the whole Tom Hanks versus Rock Hudson thing. I mean, you know, I suppose Tom Hanks was the Rock Hudson, but that comparison really kind of rubs me the wrong way a little bit. It did then, and it only has gotten worse in my mind. It really just kind of glosses over the entire difference between the circumstances of Rock Hudson disclosing and versus Tom Hanks. So I just, yeah. One quick example.
Any other thoughts? Okay. So here's a question. COVID has caused a lot of cuts in journalism, especially digital media. Many layoffs seem to be journalists who focus on features like health and LGBTQ issues versus general assignment. That said, for those who are still working in or who have an editor that's still taking freelance pitches, are there any super sexy story ideas that are just so amazing an editor would be willing to use part of that already slashed budget to accept?
Olivia?
That's a hard one.
It's a compliment. She said super sexy, so I thought you would handle it.
With gratitude. You know, I mean, sort of, I'll kind of take this outside of my own purview and say that I'm not, you know, I'm not sort of being paid to plug the source, but if anyone who's within the sound of my voice is not yet on the email list for the Annenberg Center for Health Journalism, they do weekly webinars on covering COVID-19. They're always interesting kind of story ideas that surface from that. Sometimes, I mean, oftentimes the presenters will kind of have a, you know, kind of present at the end a list of stories that they would want to see, you know, written if they had extra time. But in addition to sort of the pieces that I mentioned earlier, I will say that if, you know, folks want to not just serve my needs in terms of what I'd like to read about, there's a real kind of diverse array of knowledge and experts being lifted up, and also some really interesting story ideas that come out of those weekly webinars on Wednesdays. I believe they're weekly. So get on over there for story ideas and more.
And I could say in some of the pitches that we've received that we don't often have time to do stories about because we're, you know, and keep going, are the stories that look at this system, I can't say that word, the racism that's in the system, the barriers to care, anything that's a human-centered story that can get at why there are so many challenges for so many people in this community. We find those sexy, and we don't always have the time to be able to find the right people to tell those good stories. So perspective, that's always really helpful. I do also see one in the, I'm going to jump into this chat box quickly because it just came to panelists, not to attendees, but there's one comment from Becky Dennison about stories lifting up faith leaders who are taking care of their communities in safe ways. I thought that was really interesting. I'm concerned about stories that are starting to look like yet another war of religion versus science, with opening up the churches being framed as God, defending God or religion, just as there have been some supportive faith communities around HIV. Very true. Not enough of them, but America needs examples. And that's definitely true here and now. And it's what I think that there's a way, I mean,
you know, sort of as a queer person, as a person who's sort of worked in HIV, that I am almost comfortable with that narrative of, oh, the church is trying to get people together and thinking that God is going to, you know, save them from coronavirus, but everyone's going to, you know, that it's not serving the parishioners. I think that that's absolutely true. I'm sure that there are faith communities that are doing this in ways that honor their communities rather than putting them in harm's way. So
yeah, I just want to generalize that a little bit for, you know, it's like counterintuitive is what I think is super sexy. So, you know, if you've heard it all before, then just another story about what that is that you've heard all before is really not very interesting as a pitch. So give me a spin on it that I haven't heard. That's what I would say to that question.
Great. Okay, well, time check. I'm getting the signal. So I just wanted to say, you know, as we wrap up, I just want to say thank you all so much for being so generous with your time. Olivia, Oriol, Mark, you really are some of my heroes in covering.
Aww. We love you too, Jen.
No, yes. Truly, I look to you all for my best practices and to learn about how to live in the community. And I'm so grateful for you spending the time with us. And I'm so happy that NLGJ can draw upon your expertise. So thank you so much. And I also wanted to say thank you to the CDC's Division of HIV and AIDS Prevention for their partnership and support of NLGJ, and to the NLGJ staff for putting this all together. It really has been wonderful, and I really mean it. If people who've been watching this, if my panelists, if you all have ideas of other things that NLGJ should be doing these workshops on, we really want to help members the best we can. And this is such a great format for us. So we have such good experts, and I would love to be able to bring community together and be able to help out if we can. So please send ideas our ways. So again, thank you so much. Look to our website, look to everyone else's websites. We really appreciate you spending the time. You all take care, okay?